Clinical coding is the translation of medical terminology as written by the clinician to describe a patient's complaint, problem, diagnosis, treatment, or reason for seeking medical attention into a coded format which is nationally and internationally recognised to support both statistical and clinical uses. So how does this process work? When a patient is brought into hospital and then admitted for treatment, this is the start of their inpatient or day case stay, which is known in the NHS as a spell. Hospital staff will admit the patient onto the Patient Administration System, also known as PAS. As soon as a patient is admitted, clinical staff will start documenting that patient's treatment in their medical record. This will happen for the duration of the patient's length of stay. This must be done using terming which clinical coders are allowed to code from, to ensure an accurate code is assigned for each condition that is being treated or investigated. Once the patient is ready to leave hospital, they will be discharged on PAS, creating a completed patient spell, which must now be coded by a clinical coder to ensure the trust gets paid for that activity. Clinical coders code all inpatient and day case activity. Using the International Classification of Diseases, or ICD, for diagnosis, and the OPCS classification of interventions and procedures, clinical coders will extract relevant clinical information from the medical record and translate these into clinical codes. Once the whole spell is reviewed and translated, the clinical coder will input these codes onto PAS. This will create a Health Resource Group, or HRG, which generates a tariff for the cost of that patient's stay in hospital. Clinical coded data has a variety of other uses, such as helping to negotiate contracts with commissioners, governance, CQC, mortality indicators, and reference costs to help create tariffs, to name but a few. All inpatient and day case patient episodes must be coded within 5 working days from the end of the month in which the patient was discharged.